If you're contributing to an HSA and you enroll in Medicare at the wrong time, you could accidentally trigger tax penalties without even realizing it. Were you aware that you can no longer contribute to a health savings account once you enroll in any part of Medicare? That's right, the IRS does not allow HSA contributions after Medicare enrollment, and violating this rule could result in tax penalties. Stay tuned to find out how you can get one of our free HSA and Medicare flowcharts to help you avoid costly mistakes. Today, many Americans continue working past age 65, especially at large companies that offer group health insurance. Some of these employees are enrolled in a high deductible health plan through their employer. Certain high deductible plans can be considered HSA qualified, meaning they allow you to contribute to a health savings account to save for future medical expenses. As a licensed Medicare insurance agent, I'm very familiar with HSA plans and how they work. I actually have one myself, and I love the triple tax advantage. My contributions are tax deductible, the money goes tax free, and my withdrawals for qualified medical expenses are also tax free. HSAs can be a powerful way to build a nest egg for healthcare costs in retirement, too. And here's why. Once money goes into your HSA, it's yours forever. It grows over time. You can use it later on in life to pay for qualified expenses, including Medicare Part B premiums, Medicare Part D premiums, deductibles, copays, and coinsurance. However, there is a catch. You can only contribute to an HSA if you have no other disqualifying health coverage. Unfortunately, Medicare counts as other coverage even if you only enroll in Medicare Part A. That means once your Medicare coverage begins, you must stop HSA contributions. And this includes both personal contributions and employer contributions. If you've watched our video on Medicare and employer coverage, you now know that most people who are still working also enroll in premium-free Part A because it coordinates with their large employer coverage and it can reduce hospital costs. But if you're contributing to an HSA, your situation will be different. To avoid IRS penalties, you must delay enrollment into both Medicare Part A and B while you continue making HSA contributions. Now, the good news is that as long as you have credible large employer coverage, you can delay Medicare enrollment without any late penalty. Later on, when you retire and you lose that employer coverage, you'll qualify for a special enrollment period to enroll in Medicare Parts A and B with no penalty. This special enrollment period lasts for 8 months after your employment or coverage ends, giving you plenty of time to get enrolled penalty-free. If you enroll in Social Security benefits past age 65, you will automatically be enrolled in Medicare Part A. You cannot receive Social Security benefits without Part A. So if you want to continue contributing to your HSA, you must delay both Medicare and Social Security benefits until you are ready to stop your HSA contributions. Now, what if you didn't realize this rule and you already enrolled in Medicare Part A or you started your Social Security before retiring? In that case, just simply immediately stop contributing to your HSA. If you're receiving Social Security benefits, you cannot cancel Medicare Part A unless you also repay those Social Security benefits. And for most people, that's just not a realistic option. So at that point, the best solution is to stop contributing going forward. The good news is that you can still use the money that is already in your health savings account. You can use those funds to pay Medicare Part A, B, and D premiums, as well as those qualified expenses like doctor visits, lab work, dental care, vision expenses, and prescription drug copays. For specific HSA contribution limits and tax questions, always consult your tax advisor or review IRS Publication 969. Now let's talk about something that surprises many people. When you apply for Social Security benefits after age 65, Medicare Part A is often made retroactive for up to 6 months. That means that you need to stop HSA contributions at least 6 months before applying for Social Security, not just before your Medicare start date. Otherwise, the IRS may consider those retroactive months as excess contributions and assess penalties. For this reason, many advisors recommend stopping HSA contributions at least 6 months before applying for Social Security to stay on the safe side. This retroactive Part A rule can cause a disallowed contribution, one of the biggest mistakes that we see. This situation comes up often in our Facebook group, Medicare Q&A with Boomer Benefits. And many people are surprised to learn that Medicare can be retroactive, especially if they are still contributing to an HSA. I'll include a link to our group in the description below if you'd like to read about other situations and see how our members have handled it. Now, let's discuss Medicare Part D and employer drug coverage. Some high deductible health plans do not offer drug coverage that is considered creditable for Part D. Creditable coverage means the plan is expected to pay, on average, as much as a standard Part D plan. Each year before October 15th, your employer must send you a notice stating whether your drug coverage is creditable or non-creditable. If your coverage is non-creditable and you delay enrolling into Medicare Part D, you may owe a late enrollment penalty. The Part D penalty is 1% of the national base beneficiary premium for every month that you are eligible but not enrolled. And while 1% may sound small, it adds up over time, and it lasts for as long as you then have Part D coverage. That's why it's so important to work with a licensed Medicare insurance broker who can help you calculate potential penalties and weigh them against the tax benefits of continuing your HSA contributions. We know these Medicare and HSA rules can sometimes feel overwhelming. That's exactly why our team at Boomer Benefits is here to help you make sense of your Medicare enrollment timing and HSA contribution strategy, as well as your Social Security decisions. Be sure to download our free HSA and Medicare flow chart in the description below and give us a call so we can help you avoid costly penalties and plan your retirement transition correctly. And of course, consult your tax professional for personalized advice about your own HSA contributions. Thanks for watching, and now let's check out our playlist on New to Medicare next.